Hello everyone, we're here in Low Carb, USA, San Diego, and I've just had the pleasure of listening to an excellent lecture by Dominic D'Agostino, who's a major force in exploring metabolic theories of cancer and dietary interventions that may assist. And I think also Angela Poff just gave a really great talk on a similar topic.
Yeah, I mean, she covered all our cancer research. Angela was really the my PhD student that took the cancer project and ran with it. When was just kind of tinkering in the lab for about a year or so in cells, we moved it to an animal model, and that became her dissertation project.
All right, and she certainly delivered a really great summary of the state of the art with ketogenics. So I was going to perhaps ask yourself though, Dominic, a lot of people in the cancer world or cancer treatment world and elsewhere question whether there's an evidence base for ketogenic diets as an adjunct or helpful regime for people with cancer. And a lot of them claim that there isn't much evidence at all. So coming from where you are, you might be able to give an overview or summary of the points of evidence to date.
Okay. Yeah, from a basic science perspective, there's an enormous amount of evidence that suggests that this would be a very effective metabolic-based therapy. I mean, you could go back to, if you want to go way back, you can go back to the early calorie restriction studies that show that animals are less likely to get spontaneous tumors if you maintain them, with a 25% calorie restriction over time. The ketogenic diet mimics in many ways fasting, but also calorie restriction, in that it suppresses the hormone insulin. And we know no oncologist in their right mind should question that cancer growth is tightly linked to insulin signaling and IGF-1, which is kind of parallels insulin signaling, and mTOR and many of the other energetic pathways, anabolic pathways linked to insulin signaling. So the ketogenic diet works by suppressing the hormone insulin to drive the liver to make ketones. Like, that's really the driver. So from our perspective, from a metabolic-based perspective, when you look at nutritional ketosis, that produces a metabolic physiology that causes a suppression of the hormone insulin, a depletion of liver glycogen stores, which is kind of needed in some way, or a decrease in liver glycogen stores, and to facilitate to facilitate the liver making ketones, and an elevation of ketone bodies, which we have really put a lot of research into investigating the effects of ketone bodies in and of themselves. And ketones can reduce glycolytic flux through cancer cells. That's been shown. And ketones have an anti-catabolic effect, so a muscle sparing effect, which can be helpful for cancer cachexia. So there's lots of animal data to suggest this. What we do lack, I will admit, there is a lack of clinical human data to support that this could be an effective standalone therapy and even an effective adjuvant therapy. So the data out there is very compelling, but it's not conclusive. And I think what we need is we need human clinical trials, and to do that is we're negotiating with different cancer institutes now and setting up what will hopefully be a large trial to use the ketogenic diet as an adjuvant for grade 2, grade 3 brain tumors. When I got into this line of research about just 5-6 years ago, maybe a little bit earlier than that, I was doing cell-based research. There was really nothing on clinicaltrials.gov, and now, as evidence that that this is a very promising, compelling approach, on clinicaltrials.gov, you have no less than 10 registered clinical trials of institutes that are doing this as mostly as an adjuvant. Maybe there might be 2 trials where they're using it as sort of a last resort when the standard of care has failed. But there's emerging interest in this simply because the last 5 to 10 years, the science has emerged pointing to cancer metabolism, targeting cancer metabolism. And I see the ketogenic diet as like your base, kind of like your base, fundamental thing that you should do to metabolically manage cancer. It, without a doubt, it takes your foot off the gas pedal of cancer growth. Yes. And then it makes cancer more vulnerable to other modalities that you put on top of that. So our lab is interested in non-toxic modalities like hyperbaric oxygen, cancer-specific anti-glycolytic drugs like things like 2-deoxyglucose, 3-bromopyruvate, lonidamine, things that target cancer-specific glucose metabolism on top of that. And of course exogenous ketones, which seem to have effects in and of themselves. Yeah. And that's what Angela was presenting on, and Dr. Pa.
Actually, yeah, that was, and again, I haven't gone very deep into this area, but it was fascinating to see that the addition of the ketones themselves had an effect independent of the other pathways. So it shows that they have a power, not just the insulin reduction or the glucose reduction.
That's exciting. It's kind of new. Well, I shouldn't say it's really not new research. Actually, Eugene Fine showed, we looked at beta-hydroxybutyrate, but he had shown previously that acetoacetate had anti-cancer effects in 6 or 7 different human cancer lines. So this work was reproduced, at least with a different ketone body. The exogenous ketones that we develop and test actually elevate both beta-hydroxybutyrate and acetoacetate. So we don't know, the dosages that should be used, and there's a lot of extrapolation from an animal model to humans, but you cannot argue that the science isn't there. I mean, if the same science was supporting a drug that did this, especially if the drug was non-toxic, you would have pharmaceutical companies clamoring to get control of the license for that drug. So these ketones are not something that, we do have patents on different preparations of them, but they're not something that a pharmaceutical company would necessarily, could scoop up and use. They are very interested in the ketogenic diet as a metabolic-based therapy. I will disclose, I guess, that I've been invited to several pharmaceutical companies that want me to give talks on the signaling pathways of the ketogenic diet and how they could target those pathways to come up with a drug that's essentially a ketogenic diet in a pill. Yes. And when I present the data, what you see is a dozen or more different metabolic pathways and even non-metabolic pathways that ketones can work through various signaling properties. And it would be hard to encapsulate that into a single drug that would have that kind of therapeutic efficacy, either as an anti-convulsant efficacy drug or as an anti-cancer drug, because it's targeting so many different metabolic pathways synergistically, and these pathways are kind of working together. Unless you go way upstream and you just inhibit kind of the glycolytic pathway, or you target insulin specifically, but typically what the new drugs are just trying to target downstream pathways that are very specific targets, and you don't do that. The diet just hits so many different targets, and that's why it's so effective. That's really why it works. When anti-epileptic drugs fail, the diet works, and that would suggest that there are no anti-epileptic drugs that are working through the same mechanism that the diet is working through.
Right, it's systemic, synergistic, multifaceted. And that is a challenge because drugs, they're costly to develop. They tend to go for one specific pathway, master that, and then they got their patented drug. But to attack this is very difficult.
It is, because there's so many, metabolism is incredibly complex. And nowadays you don't have these metabolic physiologists, these icons that existed years ago, like Dr. George Cahill, who I included in my talk, Dr. Theodore Van Italy, Dr. Richard Veach, and there's many of these experts that I talked to early on when I decided to choose this path. I'm in a pharmacology department, but I'm studying nutrition really. Just because the diet worked better than any of the drugs that we were interested in using for our specific application. So I had to revisit nutrition. I had studied it a little bit as an undergrad and understand what I would call nutritional neuroscience, like how does nutrition fundamentally change brain energy metabolism and homeostasis. And that has been an incredible experience, and I think our understanding of how the brain changes in response to nutritional ketosis will also give us insight into why the diet is so effective for appetite regulation and weight control and things like that. I mean, I study seizures, but it gives me a window into understanding its practical application for a wide range of disorders.
And I think actually the cancer, you referred there to these old greats who are working on metabolic aspects of cancer, but in a sense, is it the massive dollar pile-in on genetics or theories of cancer? Was that a wave that washed all the researchers into genetics and left behind those guys?
That's a good point. Yeah, I think that essentially is what happened. You know, as investigators, say you're like a new assistant professor coming into the field of cancer biology, you wouldn't want to write grants about nutrition or targeting even metabolic pathways to the NIH or the National Cancer Institute, because you're not going to get funded. So the thing to do was to target specific molecular pathways, genetic pathways, whether it be for diagnosis or early detection or treatment. You're looking at genetic, because that is where the field went for a couple decades now, a decade and a half or more. But that's what's really encouraging to me is that now, when I get into this field of cancer research, there was no tumor metabolism conferences. Now you have several. You have the Keystone Tumor Metabolism Conference. You have a wide range of tumor metabolism conferences that have just come about. And even guys like Craig Thompson and Lou Cantley and Michael Bishop and Eugene Fine, these are the top tier cancer researchers. They are redirecting their focus to cancer metabolism, and that's great to see. Nutrition may not be their specific focus, because there are ways to target metabolism with drug-based therapies, but it gives them then an appreciation for nutrition, because you can't argue that nutrition is it's a very powerful hammer to your metabolic physiology, and it's probably the most effective way to suppress the key drivers for cancer growth, like insulin and glucose.
For sure, and it's also very little, if any, expense, and it's inherently safe and non-toxic, so it's got all those advantages while you deploy it. It's
practical,
cool.
like no-brainer advantages, but I think to like a molecular biologist, cancer researcher, it just doesn't, it lacks that I don't know what you call it, sexiness or whatever, that is it doesn't pull them to it, because unless you're looking at the epigenetic effects of the diet, or you're looking at beta-hydroxybutyrate as a very powerful endogenous HDAC inhibitor, and we know the pharmaceutical companies are clamoring over developing the most potent HDAC inhibitor for cancer therapies. Now that we know that beta-hydroxybutyrate is a powerful HDAC inhibitor, maybe we can sort of promote the use of nutritional ketosis through those means, instead of focusing on metabolism, saying look at all these signaling properties that endogenous metabolites have, and let's look specifically at the epigenetic effects of how these diets and how specific metabolites influence gene expression that could not only be part of cancer treatment, but also cancer prevention. So if you have a population of people who are predisposed to having cancer, or they've had cancer in the past and got treated, maybe they should be put on a low-carb ketogenic diet, and that's not even thought about now. I mean, to us, it's like kind of a no-brainer. You go through treatment, you have cancer, you should be following a diet that influences your metabolic physiology, suppresses growth signaling, IGF-1, insulin, because you undoubtedly have, those cancer cells in your circulation, probably in your tissue somewhere, and chances are that they can kind of take hold and reroot and start growing again. So we should do everything in our power to prevent that from happening.
For sure, especially when safe and free, as we said, it's a no-brainer. I was fascinated by that actually, because I know that in existing cancers, and I think Professor Fine, I met him and I'm meeting him next week actually, so he's a great guy. And one of the challenges is, we probably won't get into here, but funding is not so readily available for that kind of work. But in terms of prevention, the stage 4, those 10 or 12 guys, they got stage 4, they were kind of no-hope cases in a sense. When you're working with those, it's really challenging. Even if you have a good treatment, and ketogenic diet is very, very useful, taking those guys so advanced is giving it a very hard challenge. But if it shows promise in those, as it did, and the 6 remissions, I think the higher degree of ketosis gave the higher degree of remission or better results, or better outcome. Yeah, you can only imagine what if you do when it's only the occasional cancerous cell. When you're way before the cancer gets established, you apply that regime. It could have an even much bigger usefulness. So it's a shame. It's a shame that, well, hopefully this will become more mainstream, that the ketogenic diet is seen as a default kind of best case diet for cancer, whether adjunct or whether preventative. But that reminds me of one more question. Is there any real safety concern with the ketogenic diet? Some people have made the case that that could actually be a dangerous thing to do. Now, I have no evidence, but have you even come across that concept?
No. Well, I mean, there's evidence. Probably the best evidence to look at would be kids that have followed the diet for years or even decades to metabolically manage their drug-resistant seizures. They were put on the diet for that. Kids with glucose transporter deficiency syndrome, they tend to fix all their health problems. So that's a disease population. It fixes a lot of things, but I guess when it comes to normal healthy populations, there are a few studies that have been done. I think Dash-T in Saudi Arabia did like a 50-week study, I believe, long-term study. I don't see any problems with the ketogenic diet, any major concerns. What I tell people is that, get routine blood work. That's what you want to do, and you want to ensure that there's certain things that you can do. Take maybe a potassium citrate supplement to prevent the higher potential for kidney stones. Although mineral supplementation in general would probably fix that, and if you did something like a modified Atkins, there may not be higher kidney stone prevalence with that kind of diet compared to the classical ketogenic diet, which is considerably more restrictive in carbohydrates and protein. But that magnesium supplementation, I actually got a fairly bad side effect of calf cramps and leg cramps, and it may be my food choices, but when I supplemented with a good magnesium supplement, that went away and it never came back. And then I ran out of supplements and the magnesium, and then it came back and I started again, it went away. To suggest that maybe the ketogenic diet may deplete your body of magnesium. We know magnesium is used in hundreds of different metabolic reactions, and the ketogenic diet may sort of amp up or further enhance certain metabolic reactions that require magnesium, or maybe the diet in some way it maybe depletes magnesium, although my magnesium content in the diet is fairly high. So for me, that was a side effect that required me to supplement. And routine blood work, I think, is really important, because everyone's going to respond a little bit differently to the ketogenic diet. That needs to be appreciated.
Yeah, it's done carefully as opposed to willy-nilly. The magnesium has come up in a lot of places actually, that 70% possibly of the modern population is suboptimum in magnesium anyway. And the magnesium blood test, it will only show if you're really, really low. I believe if it shows okay, it doesn't mean you're really adequate or optimum. So that's a good one to raise.
And I was low end of normal when I was getting cramps and things like that. I was in the normal range, but low end of normal. And with supplementation, I'm in the high end of normal now, and I haven't been getting any cramps.
Yeah.
So I think it just makes. So with the ketogenic diet, it has a diuretic effect and probably a natriuretic effect. So you may run a little bit hyponatremic sometimes. Your sodium levels might be low, and I almost have to remind myself sometimes, especially if I'm just eating whole foods and not like canned sardines or things like that with added sodium. If I'm eating just a lot of whole foods, I got to remember to put salt on my food, or more salt than usual, because I think that's important. I think you do excrete more salt. Our renal physiology is such that it will adapt to our salt intake. But I do think as a whole, if you're suppressing the hormone insulin plays a big role in sodium retention. And if you have significantly lower insulin, which I do, I had my insulin levels measured and it was like, very low. At one time when I did a little short-term fast, it was like below the reference range. So I know I'm probably excreting a lot more sodium than most people, so I can get excess, more sodium in my diet and definitely be okay, and it would probably be helpful from a health standpoint.
Excellent, and that's certainly, we have the whole family now. Well, I have 5 children broadly on low carb as opposed to keto. Yeah. But we have, from research and personal experience, we keep the salt up, the magnesium up, and all for that reason. So it's a very good point to raise. I have one more question actually, just on this. The last question is the ketogenic diet. There can obviously be very good, nutritious ketogenic diets, and possibly bad ketogenic diets which have the fat, but it's the wrong fat. I did come across some papers in the past where they were using a lot of omega-6 fats, and there's quite a bit of evidence to suggest that omega-6 could tend towards cancer proliferation. So maybe just a few words on the best ketogenic diet that really has natural good fats.
Yeah, I think if you wanted to design a ketogenic diet study that would fail, you would probably formulate it with an omega-6 fatty acid. So our diet actually has a very little bit in there. We thought it was important to get some in there, obviously, because you do have some essential fats, and we wanted to make something that was somewhat equivalent to what would be followed from a human diet perspective. But I think monounsaturated fats, our diet has the highest amount of saturated fats from MCT oil and coconut oil and MCT.
Chain.
Yeah. So omega-3 fatty acids have been shown independently, even just added to a standard diet, that they have anti-cancer effects, anti-inflammatory effects. So Thomas Seyfried has done some work on that, and other investigators, many investigators have actually looked at the anti-cancer effects of omega-3. So monounsaturated fatty acids, saturated fats, MCT oil in addition, added to a ketogenic diet makes it more ketogenic, and I think those are the major. And I would definitely decrease or minimize the use of omega-3 fatty acids, or at least have a 1-to-1 ratio omega-6 to omega-3s or something like that.
It's the safe fat.
Yeah.
Low and balanced. Excellent.
Balanced,
right. So we'll probably, as I say, we'll be seeing Professor Fine next week, so you can say hello to him there. Cool. And Professor Feynman, actually.
Dr. Fine. Oh, really?
Yeah,
Dr. Feynman,
we're out for dinner.
An icon. Oh, excellent. Great guys.
And at that, thanks very much, and I'm delighted to meet you, Dominic. Pleasure to meet you.
Thank you.
Great work.
Yeah, thanks for having me. Yep.
Bye, everyone.